Okay, welcome everyone. Good afternoon. Thank you for joining us. I'm sorry I'm hearing an echo. If everyone can mute themselves, we really appreciate that. Thank you so much. And welcome to our regular virtual community conversations. Today's topic, we will be talking on cancer screening and care during COVID-19 pandemic.
Get the hot dogs out.
And so this this is brought to you by ChicagoCHEC and other partners, but here we're sharing some of our sites and how to reach us on ChicagoCHEC. And so we have the honor to bring this. I have to introduce myself. My name is Beverly Chukwudozie. I'm a program director for ChicagoCHEC at the University of Illinois at Chicago. ChicagoCHEC is a cancer collaborative with Northwestern University, Illinois, Northeastern University, Illinois, and the University of Illinois at Chicago. Today we have the honor and privilege to speak to Dr. Lauren Green. Dr. Lauren Green is the co-chair of the Center for Breast Cancer Care, head of the Breast Imaging and Associate Residence Program Director at the Department of Radiology at the University of Illinois Hospital and Health Sciences. We are also expecting Dr. Jonathan Moreira from Assistant Professor of Medicine at Northwestern University, Illinois, but something came up and hopefully he might be joining us shortly, but if not, he sends his apologies. We also have Nasima Manan. Nasima is our navigation manager at the University of Illinois Cancer Center and Community Engagement and Health Equity Office. She's also a lead of a lot of our community-based projects at the Cancer Center and Milesburg as well. And this is also brought to you by the University of Illinois Health Systems and also the Bristol Myers Squibb Foundation. And I also want to acknowledge Jeanette Gonzalez, who is the program lead for the project we do have with Bristol Myers Squibb at the Cancer Center. So I will start by saying that we would like this to be an open conversation. This is also recorded and we will have the recordings available on our YouTube channel at ChicagoCHEC. Please feel free to mute yourself when you're not talking. If you want to talk, feel free to unmute yourself and ask your questions, and also feel free to add your questions in the Q&A session or the chat. And one of our team members will alert me and will definitely bring your questions, will respond to your question. Something we would like to first start is, I would like to first have Dr. Green and Nasima to please share with the audience from the perspective of the hospital and navigation team, what has been observed as the major changes to cancer screening and care in their respective institution, and what measures are in place to minimize the exposure to COVID-19 in your institutions. And they could also give a little more about the work they do currently. Dr. Green, would you like to start?
Sure, thank you, Beverly, for the introduction, and thank you for having me. So my name is Lauren Green. I am a radiologist at UI Health, and my specialty is radiology, and my focus is mainly breast imaging and breast procedures. I also interpret imaging from other areas of the body, but my main focus is breast. So there's been a lot of changes since the start of the pandemic, and really the biggest first change is it seemed like the brakes were put on at the entire institution, not just in radiology or the breast imaging division of radiology. There was a lot of concern, a lot of fear initially. This is a new virus. We were not completely knowledgeable with how the virus presented itself. how it was spread, how easily it was spread, what the exact risks were to staff, to patients. And so in order to make sure that we would be able to protect as many people as possible, many healthcare organizations really decreased their volume considerably. But I will say that this has really been temporary at most institutions. It basically gave everyone an opportunity to evaluate the situation and start to put safety measures in place to ensure that we minimize the risks of spreading the virus while we are still able to administer high quality health care to our patients. So in my department specifically, we initially started by postponing the vast majority of our patient appointments. We were following a group of joint guidelines that were published by a number of national breast cancer related organizations, including some organizations as the American College of Radiology and the Society of Surgical Oncology, amongst others. And they laid out some sort of basically directives in order to help all of us decide, what do we do? We have patients who need to be screened for breast cancer. We have patients who need biopsies. We have patients who need to be treated for breast cancer. And how can we move forward in a safe manner, providing care, but also protecting everyone from the risks of the virus. So the first thing that we did was postpone most of our exams, aside from the most urgent exams, mainly patients who had highly suspicious findings that were already discovered, either by a physical examination from their clinician or by breast imaging that we had already performed before the exams were postponed. And we proceeded with those cases. But the remainder of the cases we had to triage. So basically it's similar to when you walk into an emergency department and you have a certain symptom and a nurse evaluates you and says, okay, you may be having a heart attack, you need to be seen immediately, versus someone who may have stubbed their toe, who needs to be seen and their symptoms are important, but they can wait potentially another hour or so while the patient with the heart attack is seen. So we used the guidelines that were published by those organizations and started to stratify patients into different categories based on the type of exams that they were, or procedures that they needed to undergo, and the type of symptoms that they were experiencing. So over the past, I would say since about mid-May, we started expanding our schedule a bit more. We started inviting more of our diagnostic patients and biopsies back that had been postponed. And then a couple of weeks ago, or maybe last week even, we started to expand to screening. And now we're actually offering all of our services, but we have safety measures in place, which means that we are not seeing as many patients as we usually would per day. And that's in order to help maintain social distancing. We know that the virus can be spread by close contact with other individuals who may or may not have symptoms. And so we can't fill our waiting rooms to full capacity like we were doing previously. So we have had to decrease the amount of appointments that we're offering per day. But we are still offering all of our services. So there are a number of safety measures that have been put in place. The hospital overall is mandating that everyone wears a mask. So all patients and all staff are wearing masks. If they come to the entrance of our facilities, they are given a mask. Patients and anyone who enters has their temperature taken as well. So they're temperature screened. Patients who have appointments are screened over the phone before they present for their appointment, and also in the respective departments once they arrive for their appointments for COVID symptoms. And then in our breast imaging department specifically, patients are asked not to show up very early. So you don't want to be sitting around in the department for an hour waiting, because that would start to crowd the waiting areas. So we ask that patients basically show up on time. And what's different now is, instead of registering and sitting in the waiting area and waiting for a technologist to escort you into the breast imaging area, the technologists are actually notified when you are at the front registration desk, and the patients are escorted directly into the exam room. So they're bypassing the changing area as well. They change into their gown in the exam room, where the exam is subsequently performed, and then they leave from that room. And we have also implemented increased cleaning in between exams. We clean more extensively than we had been previously, just to take extra precautions. So there are a number of things that look different. If you were a patient who had a mammogram, for instance, in our department last year, this year looks a lot different. But thankfully, we are able to offer all of our services at this time.
Thank you so much. Nasima, do you want to add anything to?
Yes, thank you, Beverly, and thank you, Dr. Green. So on the navigation end, of course, everything, as Dr. Green mentioned, everything had a break on it that applied to navigation too. Initially, navigators often are in clinics and in community setting, providing services to the community. But because we could not be in that setting, we started doing telephone navigation. So instead of seeing individuals in person, we started providing services through telehealth and ensuring that our patients are aware. So when all appointment schedules were canceled, not all patients were aware that the appointments were canceled, and they were still showing up for their appointments. And also some were concerned that their appointments were canceled, especially those that might had signs and symptoms. They started getting overwhelmed or alarmed by it. So one of the things that navigation team started doing was calling in to individuals whose appointments were canceled or rescheduled, to give them the information, the reason for why those appointments are canceled or rescheduled, and keeping them updated with it. The team also started doing a wellness check with the community members, calling in, checking how they're doing, if they needed any resource or support. As COVID-19 was moving through the community, misinformation, information, and was moving at equal speed throughout the community. So navigation team was working to make sure that our patients and our community members are informed about it. They were also sending text messages, a tailored text message, just to remind patients, if you're going for your appointments, make sure you're calling in, checking that your appointment is still scheduled, so that they're not coming out and getting exposed or getting the exposure and taking the risk and then finding out at the hospital that you're not being seen. We've also started providing smoking cessation service over the phone. It was something that with COVID-19, it is a respiratory illness. And if you are a smoker, you were more likely to be negatively impacted by it. So we wanted to make sure that our smoking patients were provided with awareness and education during that time. The team had also, as things started opening up, the team had also been reaching out to those patients whose appointments were canceled or rescheduled in May, June, March, April, May, to ensure that they're back on appointment and they're back on the schedule, and discussing the importance of it so that they don't feel like this appointment is not important, they had canceled it in the past. The navigation team has also been supporting the community members with resources, especially for our survivors that needed financial support for continuing their services, paying their bills and other things. And also they had been assisting with other medical appointments. So not many of our community members were aware that hospitals and clinics were doing telehealth. and they could continue receiving medical care through telehealth. So providing that support also through telephone calls.
Thank you, Nasima. They would like you to talk a little bit more about what you do and just introduce yourself more again.
I'm Nasima, the navigation manager at the UI Cancer Center. I actually I just lead a few community-based screening programs, which includes the MyMemo breast cancer screening program, a colorectal cancer screening program, and a lung cancer screening program. They're all housed at the Myers Squibb Health Center. And the Myers Squibb Health Center is is an FQHC that is part of the UI health system.
Thank you very much for that. I think, Dr. Green, we have a question from one of our attendees. The question is, are there changes in procedures for people with mobility disabilities due to COVID-19 virus? So in terms of cancer care and treatment.
In terms of cancer treatment, I am not sure. That's not my area of expertise, unfortunately. I know in terms of screening and diagnosis, our measures are the same. Safety measures apply to everyone, and the way that we perform our exams are very similar. The patients in any condition would still be escorted directly into the exam room, and as previously, if patients need additional assistance, whether it's changing or being positioned for certain exams, we would still bring in additional assistance from other technologists to help patients. So that has not changed.
Okay, thank you. And we do have another question. Do masks actually work?
I know there's a lot of controversy with masks, but the answer is yes. Masks sort of function in two ways, and there are many different types of masks, and I won't go into all of the details. But masks, the biggest thing that masks, their biggest function really is in this setting in the pandemic is protecting others. So if you are wearing a mask, and we know that the virus is largely spread by respiratory droplets. So if you're talking, if you're coughing, if you're singing, basically little moisture droplets come out of your mouth, and they can carry viral particles, and that's what can lead to infection in others. So if you yourself are wearing a mask, a lot of those particles are collected into the mask itself and not spread throughout the room, landing on other people or on other objects that they may touch and then touch their face from it. But masks also can, to a certain degree, protect you from inhaling viral particles that have been expressed from other individuals. Depending on what type of mask you're wearing, there's a different level of protection. But yes, in short, they do work. Nothing is 100% though. So in addition to wearing masks, social distancing and hand washing they remain very important. So it's a combination of factors that can ensure that you minimize your risk as much as possible.
Thank you for that. Another question we have was, should people still get screened for cancer during this period?
Absolutely. So although our attention has been diverted as a country and across the world quite a bit toward avoiding the virus, there are still other medical conditions that are still just as important as they were before. So yes, screening is still important. A lot of screening exams were postponed temporarily. Some of the organizations that I mentioned previously, their thoughts were that delaying one screening exam by a couple of months should not affect a patient's overall outcome. But that's not to say that everyone should be postponing their screening exams permanently. Cancers are still present, just as they were before, and the point of screening is to find cancers early. And we want to find cancers when they are early and small, because that can lead to the best possible outcome for patients, and also can allow for less aggressive treatment options in a lot of scenarios. So yes, screening is still important, but we also have to make sure that we are taking the appropriate safety precautions for ourselves. And if you do have concerns, it is certainly worth contacting the facility where you receive your own health care. And you should certainly be able to find out what sort of safety measures that they are enforcing during this time.
Thank you for answering that. I have Dolores, you have your hand raised. Do you have a question?
Yes, my question is community members, they can go and get the screen with no cost, or no, you don't take documentation or insurance in case people not have insurance or the appropriate documentation, even they can go there and to screen for colon cancer or breast cancer?
Nassima, do you want to take this question?
Could you repeat that question, Reverend, for me?
My question is, people who not lack insurance, and community member who's not had that documentation to pay for the screening, they welcome to do the screening anyways?
So okay, go ahead.
So so in terms of your medical care, hospitals and clinics are not concerned about your status in the country when it comes to providing medical care. So if you are undocumented or uninsured or underinsured, you can still get access to care, and nobody should be denying you care. However, the thing that we have to be concerned about is some places might be charging for your care and some places might not. There are many programs that are available out there that helps pay for screening for like breast cancer, colorectal cancer, and other cancers. Talk to your providers or talk to caseworkers or navigators to find out where these programs are and assist you get linked to those programs. So if you are uninsured or underinsured, you can get assistance for paying for your services. Now for, in terms of if you are insured, you can go anywhere and get that services. In terms of documentation, are you documented or not documented? That should not be a discussion at a provider's office unless it's just to do in regards to your payment. If they're trying to help you how to pay for your service. But in terms of delivering services to you, it doesn't affect it.
Thank you.
Okay. Does anybody have any questions? Feel free to ask your question. So I will go ahead. Is there someone with a question? Okay, maybe it's my echo. A question we gathered previously was that I'm newly diagnosed and I'm concerned about my care, that my care will be delayed as a result of the pandemic. What can I do?
So some care has been delayed. I can't speak to a lot of the details because that's because I don't treat breast cancer, but certain parts of cancer treatment were delayed, at least during the height of the pandemic. So for instance, some patients, their breast cancer surgery was delayed, but they were put on medications to help shrink their tumors in the meantime, so that they were able to stay home and not come in and be exposed during the height of the pandemic while they were starting to put various safety measures in place. I think a lot of institutions have proceeded with normally scheduled breast cancer treatment, but it all depends on the particular institution where you are receiving care. So I would definitely recommend contacting either your oncologist, your surgeon, or a patient navigator to find out any of those details.
Evelyn?
Sorry, I was on mute. I think this question will go to Nasima. The question is, should I get tested for COVID-19 before I go for my cancer screening? I think Dr. Green and Nasima can respond to that.
Yes, the need for COVID-19 testing depends on where you are getting your care or your screening. Hospitals to hospital and clinics, different hospitals and clinics are following different protocols. At UI Health, you are not required to get the COVID-19 testing prior to your screening appointment unless specified by the scheduler. When you're going to be calling to make an appointment, they are going to be asking you questions in regards to your exposures or any signs or symptoms. And depending on the answers with that, they will direct you accordingly. So for somebody that has no signs or symptoms or exposure, UI Health will not require them to get testing done for getting a screening. However, if there were signs and symptoms or exposures, they will recommend the testing to be done before they do come in for getting the screening. I would recommend be mindful that each hospital and each clinic is also updating their protocols. So this might also change depending on each hospital and clinic.
Thank you, Nasima. So Dr. Green, we have a question for you. I heard clinics and hospitals are limiting the number of visitors on the campus. Does this apply to appointments for cancer care?
So I would say a lot of institutions and all departments have been limiting the number of visitors that are allowed to accompany patients to different exams. It really depends on probably your individual circumstances. If you need help getting from point A to point B, and then also it probably depends on the type of treatment you're receiving and which specific department you're going to. Every department and every facility has a different recommendation regarding visitors these days. So you would have to call directly to the facility where your care will be received. And a lot of information is also available on websites as well.
Thank you. I'm trying to read the questions we have. I think this is also for Dr. Green. I am a cancer patient. What should I do to protect myself from COVID-19? How much higher is my risk of severe consequences with COVID-19? Are there some cancer patients who are more vulnerable than others?
So as with really any type of infection, whether that's COVID-19, whether it's other viruses, bacteria, if your immune system is weaker for whatever reason, sometimes that's due to medical conditions, sometimes that's due to various treatments and medications, then you are possibly at an increased risk for severe consequences. It really depends on your health, the type of medications and treatment that you're receiving. Let's say, you know, if you're currently undergoing chemotherapy, your immune system may be weaker than someone who has undergone a lumpectomy and not any additional treatment yet at that point. So it's really the individual, and that doesn't mean that everyone with cancer would have a bad outcome. Sometimes it's hard to predict, and especially with this virus, it's difficult to predict who will have a severe severe complications from COVID and who will not. We thought initially that it was just older patients and those with a few known serious medical conditions, but now we also know that young patients who don't particularly have any serious medical conditions, who are very fit, can sometimes have severe complications from COVID as well. So it's really important for everyone to be cautious, no matter what age, what, having cancer, not having cancer, or other medical conditions. Everyone really needs to be cautious because the way this disease presents itself can be a bit unpredictable.
Okay.
Do we have a question?
Actually, there's actually two questions on the chat, Beverly. This is Jeanette.
Okay,
One from Desiree Jones. She's from the University of Arizona Cancer Center. Her question is, do you think we will see an increase in cancer mortality due to individuals not receiving screening out of fear to seek care due to COVID-19? And her second part of that is, how can we combat any misinformation about screening and care regarding COVID?
It's hard. I think that's a complicated question. I think it's hard to predict, but I think it's certainly possible. If people are avoiding their care entirely, especially patients who have suspicious symptoms, like they feel a lump in their breast, or they're experiencing something, like bloody nipple discharge, those suspicious symptoms, suggesting that there could be a cancer already present. If someone waits a year or so to be seen, that could definitely affect their outcome with cancer, and that includes mortality, unfortunately. Every patient's course with cancer is different, but again, we do know that the sooner you find a cancer, the lower the rate of mortality and the better the outcome. So I think it would be inevitable if there is a large number of patients who avoid breast cancer screening and diagnostic services for prolonged periods of time. As for misinformation, I know at UI Health we are making some attempts, and we have some literature and pamphlets and other information that we are sharing with patients to try to encourage them to come in for their exams and explaining some of the safety measures that are in place. But I think there will be a population of patients who, no matter what information is shared, they may be too afraid to come in for their appointments within a reasonable amount of time.
thank you. Dr. Green, there's another question from Dr. Vida Henderson. The question is, many facilities use temperature checks to detect whether a person is symptomatic or may be carrying the virus before allowing them into the hospital or clinic. What are your thoughts on this as COVID-19 screening procedure, being that a person could be asymptomatic and still carrying the virus?
Well, it's certainly not going to filter out everyone who has the virus. It will help identify a few patients who are possibly starting to have symptoms and haven't really noticed it yet. There are some people who can walk around with a low-grade fever and not feel particularly ill or bad. So that may identify a few patients, but as we all know by this point, there are a lot of patients who do not develop any symptoms at all. And there are other patients who have the infection and just have not yet developed their symptoms. So the delay can be, a few days to up to a couple of weeks before patients develop any symptoms, and that includes a fever. So it helps somewhat, but it's not perfect. So that's why using a combination of safety measures like the universal mask policy and social distancing and commitment to hand washing and cleaning, all those factors will help reduce the risk of spread.
Thank you. We do have another question. As a provider, what are some changes you see being implemented permanently, if any?
I don't know. I'm not sure how long we will proceed with all of the measures that we have in place right now. I think COVID-19 has been certainly a humbling experience probably for all healthcare organizations. And we probably could have always done a little bit better with certain things like the amount, the extent, and the frequency of cleaning, for instance. I think there's always room for improvement, and this has shown that we all probably needed to have some additional safety measures. Other countries, for instance, some like in Japan and China, for instance, a lot of the population does wear masks and before the pandemic, and that may be something that is considered at institutions or in communities in the States going forward. But it's hard to predict. But I think it has caused us all to have to reevaluate our practices. I guess we'll have to see how things turn out with a potential vaccine, and whether there's a second or third or additional waves of the coronavirus.
Thank you. We have a couple of hands raised. We have Niji Charles. Do you want to ask your question?
Yes. Thank you. My question is, what can you advise to a patient that is in need of cancer treatment or screening but worries about payment due to the increase of unemployment? Like, is there something out there that will help them in these financial difficulties?
So yes, so with cancer screening, there is a lot of programs out there that provides financial support for patients that do not have access to insurance or does not have financial means to cover. So programs like IBCCP and also programs, some organizations receive grants or fundings for helping covering cost of screening and diagnostic services. So at UI Health, we have programs like the My Mammo program, where we provide assistance for anybody that's coming in for screening at uninsured or underinsured, helping them cover the cost for their screening and diagnostics. Now, in terms of treatment, we always connect our patients to hospitals or clinics where they can receive assistance for covering their treatment costs. So there are programs. I encourage anybody that's out there not getting screened because of the cost is reaching out. When you are talking to your doctor, ask your doctor what programs are there to help us cover for this, or are there any programs you can refer to? When you're calling the scheduling, if you do not have insurance, ask the scheduler, do you have any assistance program that can assist cover for this cost? And also you can reach out to navigators at the Cancer Center. I will share the list of navigators' name and contact information. You can reach out to them and ask them for assisting you connect to services. Thank you, Beverly. So here are a contact list of Myers Squibb and UI Health navigators, Cancer Center navigators. You can reach them out.
Thank you. Dolores, you have another question?
Yes, I had a question about what are you doing about informed communities when we get so comfortable about nice temperature, we not cover faces, we not have a social distance. And I wonder, you have some kind of infogram to inform people we still in the pandemic, because I notice in South London communities they have parties and people together like nothing happened. And I wonder you had something to inform us like we still in dangers. I don't know, you thinking in mind something?
So In terms of UI Health, they do have infographics and they do have information that they provide. And our recent conversation, they are translating that, they have the information also in Spanish. So it's probably just sharing it out and making it accessible. For our clinics, we are ensuring that when individuals are coming in, they are doing a temperature check, giving them information, ensuring that they are wearing masks. If they're not wearing masks, giving them a mask so that they can reuse it and continue using it. So I think overall, we need to continue having the conversation and continue sharing the resources with the community as we are reaching out.
But my question is more about food information in grocery store, laundry places, even people not had cancer survivors, just for the whole community to inform about, be cautious about how you communicate with other people or how close you be with the people.
So we're, in terms of community outreach, some of the things that we have done at Cancer Center with the Bristol Myers Squibb is reach out to hair salon, beauty, and we are providing assistance with that. We have not yet reached out, or we have not reached to laundry places and other places.
Okay, thank you.
I can interject. I just posted a link to the Illinois Department of Public Health for some infographics. And there's some really good infographics in Spanish, Dolores, and also geared towards grocery stores on how they can handle food and things like that. So you might want to check that link out.
Thank you, Jeanette. Do you mind just introducing yourself and the project you lead and what you do in the community?
Sure. So my name is Jeanette Gonzalez, and I am the project manager at the University of Illinois Cancer Center, Office of Community Engaged Research. And I oversee the program, the Bristol Myers Squibb Foundation, in which we're doing cervical cancer screening and colorectal cancer screenings in the community. So I did post that link earlier if anyone's interested in free cervical cancer screenings. If they're uninsured or underinsured, we are providing those through a partnership with Norwegian American Hospital and Loretto Hospital in Humboldt Park and Austin, respectively. And then we're doing community colorectal fit testing out in the South Shore community as well. So if you're interested, I think I also posted my contact info in a previous link as well. Thank you.
Thank you. Is there any other question people have? So another question that that was sent previously was, and I would direct this question to Dr. Green. As a cancer patient or survivor, what symptoms should I be watching out for and be concerned about? And what should I do if I develop any early signs and symptoms of COVID-19? Should I contact my PCP or my oncologist?
Well, basically the symptoms and signs to look for would be the same, whether you have cancer or are a survivor or not. So the most common symptoms that have been identified so far are fever, cough, shortness of breath, malaise, meaning just feeling bad or extremely tired, loss of a sense of smell or taste, a sore throat, and then abdominal pain, with nausea and or diarrhea. So a lot of different symptoms, and some of which can, cross over with various side effects from cancer treatment, actually. But if you are experiencing any of this, especially if you've had an exposure to someone who was sick or tested positive for COVID, you should reach out to your doctor. So I would say probably if you're not actively being seen by your oncologist or not actively undergoing cancer treatment, reaching out to your primary care provider is definitely a reasonable first step. If you are undergoing treatment, then you could certainly reach out to your oncologist, but you do want to make sure that you have discussed this with a healthcare provider who can give you further instructions. If your symptoms are mild, it's a good idea to call before you show up to a medical facility, just so that they can make sure they have the right safety measures in place before you arrive. But certainly if you are having severe symptoms, having difficulty breathing or anything along those lines, then you do want to be seen by either urgent care or an emergency department right away.
Thank you. So we do have a question from Erica Martinez. The question is, as you are on the front line, how are each of you taking care of yourself during this time?
That's a funny question. It's been challenging. It's been a challenging few months, and not even so much being in the healthcare facilities and working with patients, but there's just been a lot of work trying to plan appropriately for how we can best protect patients and our staff. And there's been a lot of effort required to put those plans into place and move patients' appointments around because we were very busy right before the pandemic started. Something that's helped is that since our volume has gone down, a lot of us have had a little bit, we've had more opportunities to work from home a little bit, like I am today. And just having a bit of a cushion between yourself and the hospital for a day can contribute to wellness. I would say spending time with family is certainly very important during these times. And then trying to maintain just basic good health practices. So try to be active when you can, and trying to eat a healthy diet. It's easy to be tempted to eat a lot of junk food while you're sitting at home for more time than you usually are. But given the circumstances, it's probably a great time to really focus in on healthy lifestyle practices.
Thank you. I have a question for Nasima. So for those or a patient, as someone says, I don't have a cancer referral or my referral has expired. How do I get referrals? I don't know how to connect to my doctor, and how can I get assistance with that?
So for your referral, if you have a primary care doctor, follow up with your primary care doctor for getting the referral. Your doctor can determine if you need a diagnostic or just a regular screening and can provide referral services accordingly. Now, if you do not have a primary care doctor, you can always connect with our navigators and they can assist you connect to a primary care doctor, or you can reach out to our Myers Squibb clinics. I will share the clinic's name and number. I actually think I have a slide on that. So you can contact Myers Squibb directly and get connected. Now, most clinics and hospitals are doing telehealth in addition to in-person health. I would encourage call out and reach out to them. If you do not know how to reach out to your provider or connect with your provider, feel free to reach out to navigators and they can assist you with that.
Okay, thank you. So another question we had was in terms of caregivers. So for a patient or coming in for an appointment or care, and if their caregiver has an underlying condition and considered like high risk, should they accompany them for their appointments?
Well, I think that's a complicated question. There are a lot of different factors at play. So I think the first question to ask yourself is, do you absolutely need accompaniment to your appointments? It's certainly nice to have a support system, but we have to sort of reprioritize our needs during these times. So if you don't absolutely need someone to be with you, it may be something to consider to go to your appointments yourself to minimize the risk for that person who has special risk factors. If you do need someone to accompany you, or at least to give you a ride in their car or something along those lines, can that person potentially wait in the car during your treatment? They can support you on the ride to and from, but they don't have to necessarily be exposed by entering into the hospital facility. But if you absolutely need someone to accompany you for the entire appointment, and your facility is allowing them to join you, then I would say take all the precautions you possibly can. So, make sure that the caregiver is wearing a mask. You can potentially be exposed to infection through your eyes as well, so it may be worth having them also wear like a face shield or some sort of eye protection, like protective glasses or protective goggles. Bring some hand sanitizer with you to so that person can keep their hands clean at all times. You can always bring wipes with you as well to help disinfect anything that that person may come into contact with. And then I would say after you get back home, you don't want to bring any of what may be on your clothing or your shoes or your purse into your home with you. So I would recommend leaving your shoes at the door. You can spray the soles of your shoes down with some sort of disinfectant, changing your clothes, putting them immediately into the wash, and then even taking a shower or something like that, just to minimize the potential of bringing something into that high-risk individual's household.
Thank you for that. And another question we have is, how can we use this pandemic to ensure access to cancer treatment is not impeded in the future during similar situations?
I think we've learned and are continuing to learn a lot of important lessons during this pandemic. I think a lot of hospitals have had to reevaluate some of their safety precautions. I don't think very many people were predicting that we would be in the midst of a pandemic in 2020. So I think, having a strong memory of what happened this time and learning from it, and taking these lessons forward into the future in terms of, if there is another wave down the line, or if there's a new virus and pandemic in the future, we have some methods in place now that we could potentially use down the line.
Thank you. Do we have, from the audience, do we have any last questions for our panelists?
Hi, Beverly. This is Vita. I just have a comment about someone asked about referrals, and another great resource is, I know everybody has different comfort levels and access when it comes to technology and computers, but using patient portals like the UI Health patient portal, I think Northwestern has My Chart, a number of organizations use that. That's a great resource to get access to all of your medical information. You can request referrals through those patient portals. So, I would encourage people to use those. And if you know someone who you can help sign up for them, I think it's a great resource, and they're definitely underutilized.
Thank you. Do we have any other last questions from the audience? I do have one question for you, Nasima. As a cancer patient and survivor, what can I do to find support and keep myself emotionally well during this COVID-19 pandemic?
So the COVID-19 pandemic, emotional support has really become an essential thing for us, especially given that the virus has physically isolated a lot of us. One of the things is there are many organizations out there that have started providing remote support or providing support through online platforms. Organizations such as Wellness House, Sisters Working It Out, Allah's Wings, they have been providing group sessions, Zoom classes, and other things. I would definitely encourage looking for organizations like that and connecting with them. And also, if you feel like you're in need of behavioral health support, again, the clinics and the hospitals, they are all providing telehealth, and also they're opening up to in-person visits. Please reach out to them and get that support. If you feel like you are unable to connect with any of this survivorship group or your hospitals or your clinics, reach out to navigators. And even if you feel like you need assistance, to reach out to the navigators, and they can assist you get connected too.
Thank you. And we are just at the minute. Wanted to ask both of you if you could just provide any final message you want to leave our audience with today.
I think for me, COVID-19 is, it's very scary, and it's certainly a very serious public health concern, but so is cancer. So cancer screening, cancer diagnostic services, and cancer treatment remain important, just like other aspects of healthcare. There was a lot of fear back in March, sort of during the height of the pandemic, or the first wave of the pandemic, but we've learned a lot from that, and we've made a lot of strides in terms of safety for patients and for staff. So I would still recommend undergoing these services. I would say take all possible precautions when you do so. Of course, discuss the best options for you with your healthcare provider, and you can always reach out to the facilities where you receive care to get more information to make sure that they are doing their part in terms of ensuring your safety when you go for your appointments.
Thank you. Nasima?
I would say advocate for yourself and your loved one health. Your health and well-being is more essential now than ever, especially with COVID-19 out there. You want to make sure that you are maintaining and taking care of your health. COVID-19 did not eliminate cancer. It has made us put it on hold, or it has halted a lot of care. But now's the time to make sure that you are coming back and continuing your screening. Waiting 6 to 12 months for COVID-19 to go away so you can get your screening is really going to put you at a higher risk of probably catching your cancer at a later stage. So the aim of cancer screening and cancer screening is for early diagnosis and early treatment, and we don't want you to get that delayed. So advocate for yourself. If they're canceling your appointment, ask, when can I come back? When can I get my appointment rescheduled? If they're telling you you don't need the appointment now, find out when do you need the appointment, or when can you get back your appointment? So again, continue advocating. This is the time that you should be advocating more for yourself and your health than saying, you know what, let's wait for COVID-19 to pass, because we are not sure when it's going to pass.
Okay. Thank you so much, both of you, for Dr. Lauren Green and Nasima, for your time today in discussing and answering the questions that we have. So we're hoping to have some upcoming events, so we'll keep you posted. I think that we do have a poll. Let me see if I could just send the poll and see. Please just kind of click on the poll. The question is, overall, did this conversation meet your expectation? Thank you so much for attending and being with us and asking us and providing those great questions for our panelists. And then I would say thank you. And everyone, please be well and be safe. We also posted some resources in the chat that are very valuable. After this meeting, for all who registered and attended, we'll be sharing a link of the video and the resources as well. And thank you so much. Have a great week. Bye, everyone.
Thank you.
Okay, thank you.
Thank you.